how can you reduce your joint pain by yourself without going to a doctor. In this video, I'm going to show you what result exercise will have on lowering your sugar levels and thereby obesity, and how lowering of these two can lead to a decrease in pain levels in osteoarthritic joints. So instead of preaching, I'm going to conduct an experiment on myself with a glucose sensor, with a glucose night rider, this continuous glucose monitoring device, my smartwatch and my telephone, and I will show you how exercise will contribute to your health in a long-term way. I'm going to do some cardio by walking for around 15 minutes. During activity, I'll be recording glucose levels with glucose sensor. Has been placed over Freestyle Libre Pro sensor. This is my glucose reading at 8:57 a.m. prior to exercise. It is 116. After 10 minutes of walk, my glucose level is 116 milligram per deciliter. Cardio training will not spike your blood sugar. It is good for you in the long run. It will help you to burn fat. Lowering of body weight and reduction in obesity can lead to improvement in joint pains by two methods. Number one, by the mechanical method. That is, when you have less fat on your body, that will impose less loads on the joints of your lower limb, and this by itself lead to a reduction in joint pain. The second factor, which is less commonly known, is that accumulation of fat leads to inflammation and insulin resistance. So when you develop insulin resistance, you tend to put on more weight. When you put on more weight, there is more fat in your body. Fat produces many inflammatory factors like cytokines, and these inflammatory factors can lead to joint pain. So reduction of joint pain can be achieved by reducing obesity, and this will have a twofold effect on your joint pain. Lowering of body weight will go a long way in reducing your joint pain. Another non-invasive way of reducing your joint pain is by orthobiologic injections. I perform platelet-rich plasma, stromal vascular factor and growth factor injections in Chennai. These injections, when given intra-articularly into the bone, can lead to a reduction of joint pain. So joint biologic injections in synergy with lowering of body weight will lead to lowering of your joint pain by several years. You may thus be able to postpone a knee replacement or avoid one altogether. So if you appreciate those health tips, then share it with your friends or relatives who may be diabetic or pre-diabetic or obese or trying to control their body weight. They don't know what diet to consume to remain healthy. If you found the information in this video helpful, share it with your friends and relatives. Give it a thumbs up. Subscribe to my channel to receive notifications when I upload videos like this in future. See you in the next video. Bye.